we have yet another study finding that walking is medicine, especially for people with high blood pressure or hypertension. I think you'll find this data really, really interesting because the researchers found that you need to walk at least this many steps per day. Now, I'm going to hold it out a little bit because I want you to keep watching this video, but there's some really interesting graphs finding that if you walk this many steps per day, you can dramatically decrease your odds of dying from both all causes as well as cardiovascular specific causes. So let's get into this article that, as I mentioned, this was published in BMC Public Health several weeks ago. The title of the paper is Associations of Daily Step Count with All-Cause Mortality and Cardiovascular Mortality in Hypertensive U.S. Adults, a cohort study from the NHANES data set from 2005 to 2006. So numerous people were followed and tracked for a number of years, and they had pedometers and accelerometers on their wrists. So the investigators were better able to figure out how many steps they took per day and what associated outcomes they had, and then stratified people into different cohorts based upon their step counts. Now, as you can see from these Kaplan-Meier survivability curves, the people that walked the least had a much higher odds of dying prematurely over time compared to people who walked more from both all causes and cardiovascular disease. And this is really pronounced. And look at the protective effect. We're going to focus here on Figure 2, Part A. I want you to notice this purple line here. People that walked, now here's a punchline, at least 9,000 steps per day. I mean, the standard deviation was 8,200 steps, I think 9,400 steps per day. Let's just call it 9,000. About 95% of those people survived over the course of this long duration study period, 160 months. In contrast, the people who walked the least, only about 60% of them survived. So when you think about the impact that walking just 9,000 steps per day, after adjusting for all sorts of socioeconomic and demographic variables, education, race, age, income, and all of this, walking is still really protective. So we hear so much about these social determinants of health and people in low-income communities, and well, what can they do? Well, it turns out walking 9,000 steps per day in divided doses is going to be very protective. So I want to give you some prescription here when it comes to walking and some tips that I personally use in my life, because at a minimum, I walk 9,000 steps per day, usually between 12 and 15,000, and many of my friends do. And this is basically how we do it. But first, I want to pause and thank this video show sponsor, the good folks over at Lumen.me, the makers of the most accurate at-home tool to assess whether or not you're burning fat for fuel. And this is why I like to talk about this tool around walking, because you might notice the more that you walk, the more that you will start to preferentially burn fat for fuel. And Lumen is a great tool to help validate the lifestyle endeavors and prescriptions that we're going to talk about very shortly, because this tool actually will tell you if you're burning sugars or carbohydrates for fuel or fat for fuel. It uses what's known as the respiratory quotient and measures very accurately gases expelled from your lungs to determine what your metabolism is doing. Now, I don't need to tell you, but most Americans are sitting too much. They're eating a lot of hyperpalatable, ultra-processed sugars and refined carbohydrates and things like that. So they are burning mostly carbohydrates for fuel. But if you start walking, even if you don't change your diet, you're going to notice if you start using the Lumen at home that you're burning more fat for fuel. Your respiratory quotient will actually go down, get closer to 0.8 and lower. So that's why I love this tool, because it really helps people understand and connect the dots and see the tangible benefits from doing something really simple, like going for a walk, especially in the post-meal window. So click the link in the description below or go to lumen.me/HIH to learn more. So again, lumen.me/HIH to save. So getting back to this article, again, I think this is so incredible and fascinating because, as the investigators say, this is one of the only studies of its kind to find an association between about 9,000 steps per day and a reduction, independent reduction in all-cause mortality and cardiovascular specific mortality, independent of other social determinants of health. As I mentioned, age, gender, race, income, education level, all these things do have some impact on health and mortality and disease risk. But it turns out that walking buffers against all those factors. So if you're like, look, I can't afford to eat healthy, I'm at high risk genetically or what have you, low income, and you're wondering what to do because you eat at McDonald's or you can only afford to, say, go to the grocery outlet. I understand your position, but I would suggest that you start walking at least 9,000 steps per day. As I mentioned, in divided doses. So it turns out that doing exercise snacks, participating in exercise snacks, so a 2,000 step walk spread out in 3 or 4 different sessions is going to be way better than just one bolus walk. And so I think that's really important as well. There's a lot of people that get up, they hit CrossFit, and they sit in their car, they go to work, and they sit all day, and they go home and have dinner and go to bed. So what we want to do instead, my friends, because it's good for your brain, it's good for focus, it's good for motivation, and it's good for, guess what, fat burning as well, is to participate in this notion of exercise snacks. So you can do a 15, 20-minute walk and clock in 3,000 steps. I use a Garmin watch that has a pedometer, accelerometer built into it. There's Fitbits, there's the Whoop. Even on your phone, you can track your steps. And most people have an iPhone nowadays, so it's really easy to do. And I want to talk about these survivability curves as well. And so these are the adjusted hazard ratios for cardiovascular mortality and all-cause mortality. And it turns out, especially in people with hypertension, and there's a ton of people out there that have high blood pressure and don't even know it, but if you look here at the U-shaped curve here, there is significantly lower risk of having a poor cardiovascular outcome and dying from heart disease if you walk at least 9,000 steps per day. And I think that's pretty profound. And we also see the same sort of inflection point around 9,000 steps per day for all-cause mortality as well. You start to see really a dramatic reduction in risk of all-cause mortality when individuals hit over about 4,000 steps per day, and especially as you get down below 10,000. So I think that's really important to consider and talk about. And the investigators say, to our knowledge, this study is the first to elucidate the relationship between daily step count and both all-cause and cardiovascular mortality in a large cohort of hypertensive patients. Our findings indicate that a higher daily step count is significantly associated with a reduced risk of all-cause and cardiovascular mortality independent of demographic factors, lifestyle, clinical assessments, biochemical markers, and comorbidities. Furthermore, we identified nonlinear dose relationships with mortality risks for decreasing substantially at daily step counts below 8,200 steps and 9,700 steps per day for all-cause and cardiovascular mortality, respectively. So let's just call it 9,000, okay? This is achievable for most people. I think you can do this at home. I know you can do this. So let me know in the comment section if you have been doing this or if you plan to do this. 9,000 steps per day. Let's make Americans healthy again. Let's make people throughout the world healthy again. You know, many people, as you know, throughout COVID-19, they implemented all sorts of new habits, from hand washing to hand sanitization, wearing gloves, wearing masks, social distancing. Why can't we make walking the new normal? We should be walking 9,000 steps per day. And why are doctors, not prioritizing this? We hear so much about lipid reduction and blood glucose and blood, pressure reduction. We should be focusing on walking and mandating walking. Like, imagine if you could verify with your insurance company that you walked at least 9,000 steps per day. You gave them your Garmin or Fitbit data and they gave you a discount on your insurance. Like, most people would be super motivated to do that. I don't know why we're not making or implementing some financial incentives for people to do this, because the science is clearly here. So I appreciate you tuning all the way to the very end. Thanks for hitting that like button. Please leave me a comment in the comment section below. I'd like to know how many steps you average every day, and we'll catch you on a future video down the road.